Barbershop talk is whatever the topic of the day is, be it the election, Senator Obama, it even being serious health issues, because the barbershop is a place of sharing.
This is a nexus for all type of people, from the corporate execs to the common worker on the street. Here is a gathering for people to get together, exchange ideas, information.
This is a great establishment. It's like a reach out for black, not only just older black men, but for the youth to grow up and kind of get some structure and guidance from the older cats.
And I think it is a wonderful idea for black men to come out and get tested for hypertension, high blood pressure, things like that, because men are really reluctant to go to doctors and things like that. So I think it's good that the community has a program to come out and kind of encourage the guys while they're in a relaxed environment to take care of their health.
This is one situation where what you don't know can hurt you. It's important for people to find out things as soon as possible, because with most diseases, if they're detected early enough, they're curable. And if they're not, they lead to complications and often even death.
This is something I'm extremely passionate about. I've worked for the Chicago County system, and I'm in private practice, and I definitely see a need for black men to be focused on in terms of screening for diabetes and high blood pressure. As a podiatrist, we see a lot of African American men who suffer from ulcers, gangrene, and prevention is really the key.
Yeah, I became a renal patient because I got high blood pressure, and the medication, I thought the medication wasn't working because my blood pressure would go up and then it would go down. So I stopped taking the medication. But I just want to say it's dangerous when you got high blood pressure and you don't take the medication. It will damage your organs. Mine just so happened to damage my kidneys. So my kidneys are out. And I've been doing dialysis since last year of February. Going to the county every month, and they would give me blood pressure medication because my blood pressure just wouldn't go down. I had a medical card, but still the same. I thought they were just out for the money, and I stopped taking the medication, and it damaged my kidney.
All right, Terrence, basically looking over your report, your blood pressure and your glucose level are really, really good for your age group and where you stand. Your activity level is pretty good. I mean, you work out 7 days a week, about half an hour a day, so that's keeping pretty active. What these guys want to do is just watch their diet and their activity level. It's just maintain, eat a lot of fresh fruits, a lot of vegetables, and just be active. I mean, those are the basic things you can do.
We really do believe that there's a need to get into the community and educate people about hypertension or high blood pressure and diabetes. And the thing is that we can delay, prevent, and minimize the complications of diabetes if we can actually just educate people about it and get them to be proactive in managing their disease. The ultimate goal is for people who do have high blood pressure and diabetes to control their disease. Don't let it control you, you control it.
I have never had these kind of tests before, and I always considered myself for the past couple of years being very unhealthy because I've been fluctuating with my weight and things of that nature. So I was like, when this came and he told me it was going to come, it was great for me because I had never had a glucose, whatever that is, test. You know, I wanted to check my blood pressure because I wanted to start back working out. So, you know, being at this barbershop right here, man, it's a blessing that, you know, y'all was able to come out and then when people just get the realization that, oh, it's free. You know, people jump on free stuff, man. Man, just come and just check yourself out. You know, it just may save your life.